Again, good morning to all. So today the class is the bronchial asthma part 2. The yesterday I already discussed about the bronchial asthma part 1. So today the bronchial asthma part 2, that is the drugs part. Yeah. So the inhalation corticosteroids. So the inhalation corticosteroid is used in the persistent bronchial asthma. So the inhalation corticosteroid used in persistent persistent bronchial asthma. So always remember the inhalation corticosteroid always use the persistent bronchial asthma. So the side effect of inhalation corticosteroid is the oral candidiasis. The SE means the side effect is oral candidiasis. Yeah. The side effect of inhalation corticosteroid is the oral candidiasis. So if the question asked in the exam, the inhalation corticosteroid, the side effect is the oral candidiasis. So tell the patient after the use of inhalation corticosteroid to gargle. So tell the patient after the use inhalation corticosteroid to gargle. Gargle after use. Gargle after use. After use of inhalation corticosteroid to gargle. To gargle properly. So we move to the mast cell stabilizer. Mast cell stabilizer. Mast cell stabilizer. Safest anti asthma drug. So the mast cell stabilizer is the safest anti asthma drug. That is the mast cell stabilizer. So mainly mast cell stabilizer preferred in children. Preferred in children. So mainly the mast cell stabilizer, that is the safest anti-asthma drug. So mainly it is preferred in children. Then we move to the drug omalizumab. Omalizumab used in severe persistent asthma. The omalizumab is the drug of choice for severe persistent asthma. Severe persistent asthma. That the drug of choice is the omalizumab. Omalizumab. So it also used. It also used also allergic rhinitis. The omalizumab also used in the case of the allergic rhinitis. Allergic rhinitis. So the omalizumab is contraindicated in the case of atopic dermatitis. The omalizumab always contraindicated in case of the atopic dermatitis. So omalizumab. So CI means contraindicated. Contraindicated in atopic dermatitis. So the omalizumab always contraindicated in atopic dermatitis. In atopic dermatitis. So treatment. Then we move to the treatment of bronchial asthma. So the bronchial asthma is two types. The bronchial asthma is two types. One is intermittent bronchial asthma. Second one is persistent bronchial asthma. So the bronchial asthma is two types. One is intermittent bronchial asthma. Second one is persistent bronchial asthma. The bronchial asthma is two types. One is the intermittent bronchial asthma. Second one is the persistent bronchial asthma. Is two types of bronchial asthma. So the intermittent bronchial asthma is less than is equal to 2 weeks. Less than is equal to 2. The intermittent bronchial asthma we call when it is less than is equal to 2 weeks. So the persistent bronchial asthma is called the greater than is equal to 2 weeks. Greater than is equal to 2 weeks. It is less than is equal to 2 weeks. It is greater than is equal to 2 weeks. Then we move to the treatment of intermittent bronchial asthma. Then we move to the treatment of intermittent bronchial asthma. Treatment of intermittent bronchial asthma. So the treatment of intermittent bronchial asthma, that is the inhalation of formoterol. First one is the formoterol. Formetral inhalation. Formetral inhalation. Then we also use the salbutamol. Salbutamol inhalation. Salbutamol inhalation. The salbutamol is a bronchodilator. Bronchodilator. So, the treatment of intermittent bronchial asthma. The treatment of intermittent bronchial asthma is first one is the formoterol inhalation. Second one is the salbutamol inhalation. Always remember the salbutamol is a bronchodilator. If it is the bronchi spasm, then in case we use the salbutamol, so it dilate the bronchi, so it is called the bronchodilator. Then another drug of treatment is the ipratropium bromide. We also use the ipratropium bromide. Ipratropium bromide. It is also the drug of choice for intermittent bronchial asthma. Then we move to the persistent bronchial asthma, the treatment of the persistent bronchial asthma. Treatment of persistent. Then we move to the treatment of the persistent bronchial asthma. Persistent bronchial asthma means it is greater than is equal to 2 weeks. So treatment is the anti-leukotriene. So anti-leukotriene agent. Then we add the omalizumab. Omalizumab. We add the omalizumab. So the treatment of persistent bronchial asthma, persistent bronchial asthma, that is anti-leukotriene agent, and we add the omalizumab. That is the treatment of persistent bronchial asthma. The asthma that stands by is greater than is equal to 2 weeks in our body. That is called the persistent bronchial asthma. That is the treatment of choice. So that is all about the bronchial asthma part 1, and today we also discuss about the part 2. That is all about the drugs part of bronchial asthma. So next class we will discuss the laxative and purgatives. So thank you to all.